Are you ready? All right. Good afternoon and welcome to our briefing. This week we've started the briefings on Tuesdays and Fridays. Our Friday briefing primarily will be the report from Texas A&M Corpus Christi. But we did want to bring you some information today, and so today is a day that I think is some good news for Corpus Christi. City Manager Peter Zanoni will come and give you the COVID statistics and numbers, and Annette Rodriguez will come and give you some additional information from the Health District, and Judge Canales then will wrap it up. But if you'll recall, a couple of weeks ago, we announced that we were going to have start a thank you tour, appreciation tour, and begin to visit our local restaurants to see who was in compliance and thank them for that and appreciate their efforts in this fight against the COVID virus. And they'd be surprise visits so that, if they heard you were coming, they get all cleaned up and do what they need to do, and then after you leave, they go back to normal. But if it's a surprise visit, it makes a lot of difference. That means they're doing it on a pretty consistent basis, and that's what we appreciate, and it's their commitment to doing their part to help us in the community. And so today I'm happy to report on our first report. We've got 52 restaurants that the inspectors have gone by and made their inspections on a surprise visit. So that even makes it more impressive that 52 of them were in compliance, scored a 10 based on the inspector's visit. And what they were looking for were people wearing masks, the social distancing, having their tables separated to meet the requirements, had hand sanitizer stations. They were cleaning and sanitizing the table and also just operating in a 50% capacity. And so we really do appreciate those restaurants that were doing that. And so we're going to be providing them a certificate of appreciation on behalf of the City of Corpus Christi. And this is what this is alphabetical. It's not favorites, it's just alphabetical. But this one, they're like this, and this is for Andy's Country Kitchen. They were inspected on July the 22nd and scored 100%. In terms of the points for being in compliance. So we just want to provide them a certificate so they can have it and realize that people do appreciate their efforts. And what you might want to do, we will be providing this list on the website right down here, www.cctexas.com/praiseworthy. So I'll go over the list with you because I think they deserve some public recognition and public thanks, and so I want to do that. But at the same time, you may not be able to catch them, and then we have a couple of restaurants where there's more than one restaurant here in town goes by the same name. So if you want to know which address it was, it may be both of them. So they would be on that list at the www.cctexas.com/praiseworthy. But let me run down the list real quick. I don't want to bore you, but I do think it's important. You never can say thank you enough. And these folks have really been over backwards trying to help us and stay in compliance. And it's cost them their business. It's cost them some business. They're hurting. So I would encourage you, if you are going to go out to eat, to see if they've won their in-house dining is still available. Some of them still are just carry out or take out. But go by and give them some business if you possibly can. But let me just quickly go down the list so that you can at least get an idea of the folks who are helping us in this fight. I've already mentioned Andy's Country Kitchen, Applebee's Grill and Bar, B&J's Pizza, the original, Bamboo Garden, Bill Miller Barbecue, BJ's Restaurant and Brew House, Black Marlin Bar and Grill, Brewster Street Ice House, Bubba's 33, Burger King, number 11690, Cancun Grill and Cantina, Castaways, Century Theaters, Cheddar's Casual Cafe, Chick-fil-A, Chili's, Chuck E. Cheese, Dairy Queen, and Dairy Queen. There's two of those, and one of those, since the health district is Nueces County, Corpus Christi, one of the Dairy Queen in Corpus Christi and the Dairy Queen in Port Aransas. The Donut Palace, again in Port Aransas, and the Donut Palace on Padre Island Drive. So this is not just Corpus Christi, it's all of Nueces County. Finn's Grill and Ice House, Fresh Donuts, Fuddruckers, Hester's Cafe, In the Game at Fuddruckers, Jackfish Cart Rentals, Jalisco No. 3, Jason's Deli, both the Saratoga and the airline Jason's Deli, K-Bob Steakhouse, McDaddy's Family Chicken, Moby Dick's, that's in Port Aransas. McDaddy's Family Kitchen is also in Port Aransas. Nueces Cafe, that's Northwest Boulevard in Robstown. Padre Island Burger Company, Pizza Hut, Port A Pizzeria, obviously in Port Aransas. Price's Chef, Red Lobster, Rigatoni's Italian Restaurant, Saltgrass Steakhouse, Starbucks, Subway, that's Subway on Padre Island Drive, and that must be on the island. And the other one is Subway on Padre Island Drive at 10529. Sweet Swirl, Taqueria Jalisco, Taqueria Mi Pueblo Mexican Restaurant, TGI Fridays, Trout Street Bar and Grill in Port Aransas, Twin Peaks in Corpus Christi, Whataburger 966, that's on South Staples, 7434, and Whataburger 286 on South Padre Island Drive. They'll all be getting a certificate from the City of Corpus Christi, expressing our appreciation to them in being in compliance and helping our community stay safe. And we would encourage you to patronize those restaurants and thank them for their business. And they're really going their extra mile to do that, to try to stay in business and yet stay in conformity with the health requirements. So it's a real pleasure for me to do that. Now, we found some that weren't in compliance, but we're not going to tell you who those are. That's not the purpose of this. We want to thank people, and I think probably next time they go get an inspection, they probably will be. And so we'll be bringing you another report. I can't tell you when, because they might figure out, well, they're going to be making inspections the next 3 or 4 days. You never know when they're going to be coming by, but we do want to say thank you, and we'll continue to give recognition to those that are helping out. So at this time, I'd ask Peter to come and give us the report on the numbers today. And we're going to win this fight, and I think we're continuing even with the kind of the surprising data drop that was put on us Sunday and Monday. I think we're still headed down. I haven't seen the graph, but I still think we're headed in the right direction. But it took a little bit of air out of the balloon to get those data dumps Sunday and Monday, but we're moving forward and we're moving downward, which is the right direction. And so we want to thank you very much for that. Peter?
El día de hoy tenemos buenas noticias para la ciudad. Hace un par de semanas le notificamos que visitaríamos a los restaurantes para determinar quiénes están cumpliendo con las reglas. Y nos da gusto que están haciendo de su parte. Son 52 los restaurantes en el condado que están cumpliendo. Parte de esas reglas es la utilización de cubrebocas, el distanciamiento social, la desinfección de mesas, entre otros. Estos restaurantes van a recibir un certificado de agradecimiento. Para ver la lista completa de los restaurantes puede acudir al portal www.cctexas.com/praiseworthy. Posteriormente le tendremos otro reporte en cuanto a los restaurantes que están cumpliendo. Le queremos agradecer a todos los restaurantes por cumplir y ayudar a su comunidad.
Hello. Hi. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and I'm going to give you the statistics for the day. We'll talk about number of new cases and talk about hospital stays, any changes in hospitalization to include ICU, and then also talk about number of deaths. And so one thing I'm going to try to explain here in the beginning, since our last briefing, we have received a couple of days of what we call data drops or data dumps from the state. And the state is managing some of our case load for us. So as as laboratories submit information to the city, the state has access to some of that information. And so a lab may be submitting information directly to the state or to the city. In either case, the state is completing the analysis and the follow-through with the person. And then they put the information in a database, and we should have access to it, but in some cases, the information hasn't come to us as soon as we had hoped. And so in recent days, and it happened a couple of weeks ago too, over the last couple of weeks, we'll get big data drops with numbers that really go back to a month and a half ago. And I'm going to show you that on a graph, so we'll try to explain it here this afternoon for you. So this graph here shows our number of cases without any data drops from the state. The numbers do include daily data points that we do get from the state that are on time. And so as an example, today's 308 number has a few cases in there from the state, and it also has cases that we get from our lab and others that we're working on directly. So go back one slide, please. Okay, so today's number is 308. You can see yesterday we had 64, 195 on Sunday, 85 on Saturday, a bigger number on Friday, 436. So you can see the numbers, if we go back about 2 weeks, we're in the 400s, about in the 300s last week, and we're kind of there again today, about 300 new cases every day. The 7-day average, I'm going to show you towards the end of the presentation, is 225. And so we can have about 300 on a day, but then when you have a low weekend count, to include 85 or back down there is probably some weekend counts. It brings down that 7-day running average. Okay, so let's go to the next graph real quick here. So this is what we showed the last 2 days. These are these big data drops we got from the state. So remember that 64 from yesterday. And then the other day we got a huge amount over the weekend. I think this was Sunday, right? And that was this. These are all, and I'm going to show you how those distribute over time. So let's go to the next graph. So taking those 2 days that we had those significant data drops from the state, we know what day those cases were confirmed. And so what we've done is we've gone back and we've mapped it out, charted it out, graphed it out, going back over time. This starts at 6/26, so June 26, and it comes all the way to August 3rd. That's the extent of these data drops. So June 26 to August 3rd. It was about 1,000 cases. If you go back one more slide to go back one. This is about 1,000 cases that happened in the past, and we just got them from the state in the past 2 days. Right, so 444 plus 647 is a little over 1,000. And when we go to the next graph, this is how they distribute over time. The yellow is the data drop in retrospect. Okay. So these graphs, the taller lines there are in the 600s, just so you can kind of eyeball it. And you can see the mid-range is that 300 number, and then 200. So you can kind of see if you look, a 7-day average about 225. It's been higher in the past, but hopefully that it helps to explain some of those data drops. We have talked to the state, that's the state health department, and we've expressed our dismay and concern. We've had some of our legislative delegation, to include Representative Todd Hunter, that got involved as well to say, come on, we need some more timely reporting. And apparently there's a computer software glitch or issue, and they think it may be solved. So we'll continue to work with the state. We appreciate their help, but we want to make sure people have confidence in the numbers. And so my point is we did reach out to the state, and we're working with them, and so are others, to make sure we get good information. Okay, let's look at our recovery, number of recovered cases. This is something we show each day when we present. And so we have about 15,000 total cases in Nueces County since we've been counting. 8,000 are still active, and that's 52%. And we want that number to drop. We want more persons in the recovered category. You can see in the orange, there's about 7,550 recovered persons, and so that's about 48% of all the cases. 52%, or the 8,000 cases, are still active, and 249 deaths in Nueces County. Okay, when we look at hospitalized patients, these are persons that need more extensive treatment to recover. Today we're showing 275 persons in the hospital, and that's a decrease of 3 from yesterday when we had 278 in the hospital. So of the 275, our next chart shows that 114 are in intensive care. They need more extensive help. They're in intensive care. That number of 114 is 3 more than yesterday. Yesterday we had 111 persons in ICU, and so 3 more. You can see the trend line over time is slightly coming down on both hospitalizations and ICU stays. Okay, and in our number of deaths, we are reporting 6 additional deaths today. And so yesterday we were at a total of 243 deaths for Nueces County since the beginning of tracking COVID-19. With today's 6 additional, that brings our new total to 249 deaths in Nueces County. Okay, and then this final graph will show number of new cases in the bars in the blue. And it does have that trend, the trend line in red. And you can see it's still kind of descending from our high peak around the middle of July. And it tends to go down and then go back up a little bit more. But this is reflective of the distribution of the data drops from the state, meaning that they're in the bars distributed over the time. And as I mentioned earlier, our 7-day average of number of new cases per day is 225 cases based on the past 7 days. Okay, so that concludes my portion of the briefing on the statistics. We're going to get it translated into Spanish. And Gabby is back. Gabby, hi. And then Annette is going to come up and talk to us about some additional health matters. Thank you.
En las últimas 24 horas se han reportado 308 casos confirmados por el coronavirus, haciendo un total de 15.551 casos. Más de 52.000 pruebas se han llevado a cabo por parte del Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. 7.550 pacientes se han recuperado por completo, 275 personas continúan en el hospital, 114 están en la unidad de cuidados intensivos. 8.000 casos continúan aún activos. El día de hoy se reportan 6 fallecimientos. A la fecha, los fallecimientos totalizan 249 personas. Le queremos notificar que el Estado nos ha estado ayudando con la información y datos de nuestra toma de especímenes, aunque esta información no está disponible al instante. Esas cifras las hemos estado recibiendo y añadiendo a nuestras cifras locales, y por eso los números han cambiado en cuanto recibimos los resultados por parte del Estado. Asimismo, hemos hablado con el Estado y les hemos hecho saber que nos preocupa que nos lleguen los resultados tan tarde, pero hacemos lo posible por mantenerlo informado con las cifras lo más precisas posible.
Good afternoon, Annette Rodriguez, Health Director. So the Health District will conduct another drive-through tomorrow at the Health District. We conducted a drive-through yesterday with 22 people going through and 4 positives for an 18% positivity rate. This number is currently on the downward trend, but again, do not let your guard down against this virus. One of the new features in our drive-through is that we are now conducting a pulse oximeter on every person that goes through. This will give us an idea of who may be more critical than some other individual. In an effort to help these individuals that may be more critical, the judge also has helped to set up an outpatient COVID clinic that is now open at 2601 Hospital Boulevard. And I use the word open loosely, so I'll explain it. So this clinic is to help COVID-19 positive patients with care outside of visiting the hospital. COVID-19 positive patients that do not have a doctor and have concerns with their recovery are welcome to call the 361-826-8019. The outpatient care clinic is operating Monday through Friday from 8 a.m. to 5 p.m. This clinic is not a walk-in clinic, So please make sure that you call in advance because the building is locked for safety measures. In preparation for the reopening of all the different ISDs locally, the Health District has been having a series of drive-through immunization clinics. These are opportunities to get your students vaccinated before school resumes. Drive-through clinics will continue this Friday and Saturday, August the 14th and 15th. The drive-throughs will be from 7:30 in the morning to 11 a.m. and are by appointment only. Please call 361-826-7238 to get pre-screened and to get an appointment. You can also find this information on our website at the www.cctexas.com/coronavirus. As we move towards reopening the schools face-to-face, our focus is mainly on how we can safely return our students, our staff, and our faculty. A good place to start is by each one of us taking every precaution to keep ourselves safe and therefore keeping everyone around us safe as well. This continues to be a community effort. If we practice wearing a mask when in public spaces and staying at least 6 feet from others, we will see our numbers decrease. Doing the opposite will give the opposite effects, including an increase in hospitalizations and deaths. Continue to wash your hands often, cover your sneeze and cough, do not touch your eyes, nose, and mouth with dirty hands, avoid people who are sick, and if you are sick, stay at home. These simple practices will reduce the spread of COVID-19. My sincerest condolences go out to the family members of the 8 individuals that lost their battle against COVID-19 today. Stay strong in this fight, and as always, stay informed. Thank you.
El Distrito de Salud llevará a cabo otra toma de especímenes móvil el día de mañana en el edificio del Distrito de Salud. Los resultados de ayer fueron las 4 personas positivas de un total de 22, haciendo un 18% la tasa de positivos. Para ayudar a los pacientes positivos del COVID-19 con atención fuera de un hospital, ahora está abierta una clínica para pacientes ambulatorios del COVID-19 ubicado en el 2601 Hospital Boulevard. Los pacientes con COVID-19 positivo que no tienen un médico y tienen preocupaciones sobre su recuperación pueden llamar al 826-8019. La clínica de atención ambulatorio funciona de lunes a viernes de 8 de la mañana a 5 de la tarde. La clínica no está abierta para personas sin cita previa. En preparación a la reapertura de todos los diferentes distritos escolares, el Distrito de Salud ha estado teniendo una serie de clínicas de inmunización. Estas son oportunidades para vacunar a los estudiantes antes de que se reanuden las clases. Las clínicas móviles continuarán este viernes y sábado 14 y 15 de agosto y serán solo con cita previa. Llame al 826-7238 para obtener una evaluación previa y una cita. La información también está disponible en el portal www.cctexas.com/coronavirus. Para el regreso a clase seguro, continuamos recomendando el uso de cubrebocas, mantener los 6 pies de distancia de otras personas. El no tomar estas medidas, las cifras en personas positivas al virus puede aumentar, así como hospitalizaciones y consecuentemente los fallecimientos. Continúe lavándose las manos con frecuencia, cúbrase la boca al estornudar y al toser, no se toque los ojos, la nariz o la boca con las manos sucias. Evite a las personas enfermas y si usted está enfermo, quédese en casa.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. So I think today, we should start by talking about information and data and orders. And so early in the pandemic, I said that I would be guided by science and let data drive our decisions. And I think, and I hope I have done well about repeating that line often. And when I say data, I'm not just talking about the number of positive tests, although those are very high, or people in the hospital, people in the ICU, people on ventilators, and people who have died. Those are primary indicators of how our disease is progressing in our backyard, in our community. And those data points are very, very useful for me. But they're not just useful for me, they're useful for the mayor, for the city manager, for our health department, and quite frankly, all those involved in healthcare decisions. They tell us where we stand relative to our capacity. Do we have enough hospital beds? Do we have enough nurses for those hospital beds. And we have used data time and time again to request more help from our state, more help from our federal government, and quite frankly, we've used it to communicate better with you. We've used this data to establish the COVID clinic that Director Rodriguez just talked about. And we've used this data to advocate for an alternate care site, which will be located at the Northwest Clinic run by HCA in Canales. Our ability to handle this crisis exceeded our available resources. And that's not anything to be ashamed about. Nobody could have possibly had enough resources to see what was coming in the month of June, late June and July. It was less than a month ago that we were on national news because we had to add additional morgue space to our community. We had to add additional beds. We had to request team after team and extension after extension of those nurses. We had more people dying than we could handle. And it's sad to me that some of the things that we've had to talk about with you included asking for another FEMA morgue trailer. But those are the things that we did over the last month. And the daily case data that you see here in the press briefing isn't the only piece of data that matters to me, although it's very telling. Public health, public safety, public finances, all are interconnected, and they're all vitally important to me as I make decisions as your emergency manager. How do our actions actually impact the economy? Who is out of work? What businesses are closed? And we know that the loss of a job is much more than a loss of an income. It can lead to other problems, behavioral health problems, the diseases of despair, like alcohol and drug abuse, overdose and suicide. What about our personal freedoms? What about the rights that we have? And balancing them between public health and personal liberty. Look, none of these are easy answers, especially since this virus spreads in such a virulent way. And we won't always know what's working and what isn't at a particular point in time. We make the best decisions we can with the best information that's given to us. And every action we have has what I call secondary order effects. And we saw that this weekend in Port Aransas. Now, yesterday I met with Mayor Bouillon, David Parsons, the city manager, the emergency management coordinator, Rick Adams, and I believe the police chief was also on our Zoom call. And joined together in this emergency management team was myself and our emergency manager, Melissa Munguia. And we discussed jointly how we can work together to slow the spread of COVID-19 and reduce road congestion and traffic to ensure that emergency vehicles can operate safely within Port Aransas, and how we would carry out these actions in the most cost-effective way possible. All of these are the considerations that we went through yesterday. There's no doubt that I'd like to repeat to you, because it matters to me, that you know that our success depends upon cooperation, coordination, and collaboration at all levels, both cities, big and small, of course, our county, and our state and our federal partners. As we create rules that require each other's cooperation and adherence, they're all designed to deliver results. And I look forward to continue to work with Port Aransas because they are a vital partner, not only to our county, but they're vital in our emergency management effort. And I am highly encouraged by a few trends in our data points. And there are others that concern me still. The ones that concern me are the ones that show that we have had an average of 300 cases every day for over a week, actually almost 2 weeks now. Some of the trends that I'm more optimistic about show that we're bending this curve. There's no doubt in my mind that this curve is being bent. And it's the actions that we have taken together that are bending this curve in the right direction. And here's important. We're adding capacity. So we're going to continue to look at all the data, and we're going to continue to get input from citizens that we serve. And we're going to make good decisions going forward. And so I would ask you that when you say, what is your data? What decisions are you making with that data? I would say that all the orders that have come out of the county judge's office are driven by both science and data points. And it's not on one particular day. We look for trends. We look for all of the pieces of information that I've outlined for you. And we look for those pieces of advice that come from our medical experts in our community. Because what's right for us in Nueces may not be right in West Texas or North Texas or East Texas. What's right for us is determined by our own medical health experts, our local health authority, our health department. And when we combine their expertise with those data points like positive cases, number of beds, number of hospitalizations, number of ICUs, and when we see a trend that's bending a curve, we want to keep driving that curve down. And that's what's driving those decisions. All of that cumulative data. I know you want to bend that curve. That's always been our goal from the moment that we spiked. And I'd like to say that the trend in bending that curve needs to not only continue, but I'm going to encourage it on by continuing with this good decision making that's driven by this data. Now, I'd like to just end with talking about money, because it seems that money does help us provide the resources for the things that we know add capacity, like clinics, like alternate care sites, like enough resources and personnel for our health department. And on May 11th, Governor Abbott, Lieutenant Governor Patrick, and the senior members of the Texas legislature issued a letter on guidance on distributing federal funds available for coronavirus expenses through the CARES Act. And the rules for counties of our size allocated funding on a per capita basis. And the money went directly to where each resident lived. And the county received funds for those living in the unincorporated areas, and the city received funds for those living in the city limits. And that allocation wound up being about 90% to the city and about less than 5% to the county. But because we have a 60-40 split on city-county health, I actually have asked on behalf of the county commissioners for that allocation to take place. So many of you might have heard that I did make public comment today, and I did so based on Governor Abbott and other state leaders' recommendation encouraging cities and counties to work together to address expenses that cross jurisdictional lines. And today is the 3-month anniversary of that letter, so I did appear at City Council today to make certain that in my capacity as county judge, I was representing our county interest and making certain that our opportunities to work together to address future expenses would cross jurisdictional lines. And in working with Mayor Bouillon and Mayor McComb this week, I was reminded of something. I was reminded of the enormous pressures that they face. I was reminded of all of the concerns that they hear from their constituents. And I'm gratified that our discussions have been both positive, polite, and productive. And we are moving forward. We're moving forward together as a team. When you are charged with being the emergency management officer for the county, it seems that nothing can happen fast enough. That's how I feel. And as I said before, I don't have any magic wand or bullet to make any of this go away. I wish I had a cure. I wish I knew a better treatment. God, how I dream of the day that I'm creating mobile vaccination lines instead of mobile drive-through testings. But what we do have here is a team of dedicated officials that are working together to make the best decisions that we know how to make to contain this virus in our backyard, to get us out of that top #1 spot that we were in just a few weeks ago. We're doing this not just to contain the virus, but also to care for those who are sick with the virus. We're doing it so that we can keep our economy intact and our workforce healthy and strong. And we're doing it to preserve our way of life. That's why we're doing what we're doing. That's why those orders exist. That's why it's so difficult, because this virus has invaded our way of life. And I want to take it back. So we're going to continue to work together as a team, and we're going to continue to let data, as I said, drive these decisions, and we're going to keep to our orders, and we will have that lookout point, and it is not many days away. And together we're going to see this problem through. So as your emergency manager, I always want to go fast. I want to quickly bend this curve. I want to quickly get to the other side, where those sunny days lie ahead. But there's an African proverb that I once heard, and it said something like, if you want to go fast, go alone. But if you want to go far, go together. I want to go far, ultimately. And I want to go together with you, Mayor McComb, Manager Zanoni, Mayor Bouillon, Manager Parsons. This message is directly for all of those electeds that are working side by side with me in the most difficult of times, in the most unbelievable circumstances. And I ask that we have a vision to go far together. And I look forward to answering any questions that you might have with regards to my comments or to any of the orders as soon as this press briefing is concluded. Thank you.
En resumen, como le he notificado en varias ocasiones, la toma de decisiones las hemos hecho basadas en los datos que recibimos. Esos datos son muy útiles para todos nosotros. Nos dicen qué podemos hacer y con qué recursos contamos. Esos datos nos han ayudado, por ejemplo, para abrir la clínica que anunció Annette Rodríguez. Toda la información que recibimos es vital para todos. Las cifras de personas afectadas es muy importante. El día de ayer tuve una reunión con un equipo de manejo de emergencias para continuar la reducción de los casos positivos, así como poder contar con un mejor plan en el área de Port Aransas en cuanto al movimiento vehicular. Entre los datos que más me preocupan es el promedio de casos positivos, que son más de 300. Otro dato importante es que hemos añadido más capacidad en hospitales. Todas las órdenes que han salido de mi oficina están basadas en la ciencia y los datos, así como las tendencias de esa información. Asimismo, las órdenes están diseñadas para nuestra área y nuestra comunidad. Creemos que también la curva se está doblando. Esa curva debe continuar bajando. En cuanto a la situación financiera por parte del gobierno estatal, se ha destinado dinero para el condado de Nueces para ayudar a los gastos. El 90% fue destinado a la ciudad y alrededor del 5% para el condado, para áreas no incorporadas al condado. Todo nuestro trabajo que hemos hecho y las órdenes las hemos emitido han sido para vencer el virus, para mantener a la comunidad con buena salud. Vamos a continuar a emitir órdenes basadas en datos e información.
Okay, that concludes the briefing for today. If there's anyone has any questions for the judge or the city manager or our health director.
Laundry list for Annette. I have a few questions for Annette.
For Annette, okay.
Sorry, I mumbled. Okay, so it's all regarding the data dumps, essentially. The positive tests that came from the state, do we know where they came from? Or were they National Guard tests from other counties, private labs?
So you can't actually tell that from the lab slip, because we did look. But what the region told us, and that's the Department of State Health Service, Region 11, they told us that most of them came from Edinburgh, and that individuals from Nueces County actually went to get tested in Edinburgh when they were having their big drive for what was called then the military testing teams, and they were doing thousands of individuals. And so the data dump from Sunday, the majority of them came from Edinburgh, Nueces County residents that traveled to Edinburgh to get tested.
So adjustments were made to the totals from Sunday to remove duplicates. Were duplicates removed previously, and have all duplicates been removed from state data dumps?
Well, we hope so. So when we receive it from the state from Sunday, so we go through, and what we're seeing is we'll see like Annette Rodriguez, and then we'll see somebody else, Annette Rodriguez, somebody else, Annette Rodriguez. And so we go back, and there's like 4 Annette Rodriguez's, and they all have the same date of birth. And so we're going through, and we're taking 3 of them out and leaving 1. It's a large list. Again, it looked like close to 1,300 when we received it on Sunday. So that's the first step. After that is we upload it into the computer system, and then the system actually takes those duplicates out as well. And then we go back kind of a third phase just to make sure we don't see any duplicates. So we have been working on this for the last 3 days.
Has the state indicated whether there would be more data dumps?
That's what?
Has the state indicated whether at some point in the future there will be more data dumps given?
So the state basically, and this is in Austin, the Department of State Health Services, they basically told us that they have a new beefed up computer system, that the NEDS, which is the National Electronic Data Surveillance System, was very slow. And so they beefed up their system. And so now they're actually finding that there's some glitches in the system. They're trying to correct those glitches, and that's why we're seeing them pull some of these additional cases. Some of them go back to late June, but they've guaranteed us that they've all been called, that they've been notified, that they're positive. And some of them are as recent as this Saturday, but the majority of them are from late July. So
that goes into my next question, which is, so the state, there was a delay reporting them to the county. That does not mean there was a delay, or does that mean there was a delay reporting them to the individuals?
no, and I mean, it is when they come back as positive, that's when they were notified. So they were notified, according to the state, they were all notified. I had my staff start notifying them also on Sunday. So they've been calling, and everybody that they've called already knew they were positive.
Maybe for you or other officials, what would officials say to residents who may question the data after this?
I can understand completely. We were all scratching our heads, upset with, a data dump right now is not a good time. We're actually kind of seeing our trend, like the judge said and the city manager said as well, the mayor, that the trend looked like the numbers were starting to come down, and then we see this huge data dump, and it just throws the numbers off. It's disappointing, I think, to all of us, but being able to go back and put those numbers where they actually belong with those yellow boxes on the bar graphs, I think is going to be helpful, because it's so important, the statistics right now. So, thank you.
Got any other questions?
Yes. Does the city plan on opening the latchkey programs when schools go back?
Peter, the latchkey programs?
Yeah, the question was, do we plan on opening the Latchkey program? That's an after-school program that the city provides in partnership with several of the school districts, and the answer is yes. However, we had a similar program this summer, the summer Latchkey program, and just about every site had to be closed down for 15 days, and one, I think we had to do it twice because of some COVID cases that happened with the staff, I think, primarily. So they'll be open so long as they're safe, and if people have to be quarantined, or if there's an outbreak, or if there's positive cases, and when you do the contact tracing, if people were exposed, then we'll have to close it down for that 14-day quarantine period.
I have one question for the judge. it's regarding the order. Will the beach be open to vehicle access as it was a few days ago? Will the order be enforced? And is the county providing any resources?
Yes, the county is going to provide resources, and also we're going to make sure that we have a good plan that can basically achieve our goals. And as I said, part of the goals is to make sure that we reduce the spread of COVID-19 by mitigating the amount of travel we hope that would come into the county. But having said that, I want to make sure that we provide, there's lots of people that have homes and condos and short-term rentals, and they're locals, and we want them to be able to have their open beaches. And so if there is a situation where there's a public safety concern, like there occurred this weekend in Port Aransas, we've sat down with the emergency management team there and said, let's develop a better traffic plan. Let's come up with a solution that achieves both our goals. And I think that that is something that, you know, quite frankly, I'm proud of, because it shows that you can work together and you can address problems that come up. And prior to this weekend, there had been complete support for the beach order in Port Aransas by their elected officials. And so I want to make sure that I'm always having a collaborative discussion. And as I said, I think that you can count on the county for resources, for manpower, and quite frankly, to collaborate so that we can get a plan that Port Aransas thinks is very workable. So the orders will stay in place till the 17th, because that was what I made a promise to our medical health providers. They asked me, as an emergency manager, to make certain that we could do everything in our power to add capacity to our hospitals. How do we do that? We reduce interactions. How do we reduce interactions? We don't encourage 25,000 cars like we had a Memorial Day weekend in a certain time interval when we can have 4,000 cars. And so we think that the data supports that decision, and more importantly, we think that it's working. And when you see that curve bend, you feel somewhat relieved that we've added capacity, because less hospitalizations and less folks in the ICU is where we want to be. We want to keep driving those numbers way, way down.
Any other questions? All right. I did get one text. Somebody fussed at me for not saying who was not in compliance. When the health district finds someone not in compliance on the second go-around, I think they will be issuing citations. But until then, we want compliance is what we want. We're not here to embarrass anybody or create any problem. And I know some people want to get a pound of flesh, but we're here to get compliance, and we're doing everything we can to be positive to get there, and participation and encouragement. So we'll bring you the next list of the folks that have been in compliance, and if we go back and find some that do have a citation issue, that is public information, and we'll be happy to share it with you. Thank you. And the Friday press conference, I think it's Texas A&M and Peter giving you the data. I don't know whether the judge will be here or not. I don't know where I'll be, but for sure you'll get at least the report from Peter on the statistics and from Texas A&M, and you may get me and the judge or both. All right, see you then.